www.healthcmi.com, Acupuncture Continuing Education Online. Researchers find acupuncture effective for the treatment of hypertension, high blood pressure. In fact, acupuncture matched the drug nifedipine for the treatment of high blood pressure. Nifedipine is a calcium channel blocker, and it relaxes the heart muscles and blood vessels. It's very effective. But the researchers at the Jiaozhou Tongren Hospital found that acupuncture was equally as effective. Now, for immediate results, right after taking nifedipine at the 5, 10, 15, and 20-minute data points, nifedipine did outperform acupuncture. But then at the 30 and 60-minute data points, so 30 and 60 minutes after treatment, acupuncture matched nifedipine. So there's some advantages to both. One, obviously the immediate, instant effects of nifedipine were outstanding. Acupuncture, however, within that 30 to 60-minute range, match those results, and acupuncture has the advantage of regulating blood pressure and not having adverse effects associated with it. So there is a hypotensive reaction where sometimes nifedipine will lower blood pressure a little too much, and that can cause some problems, especially with dizziness. And particularly when patients are dehydrated at the time of taking the medicine or the first time they use it. Acupuncture was very interesting because they found out that for patients with extremely high levels of blood pressure, acupuncture brought the blood pressure way down. However, if patients had moderate levels of high blood pressure, acupuncture only moderately reduced the blood pressure, so it had a regulatory effect. And that's not the only study published in this article showing that acupuncture regulates blood pressure both in the short and long term. And there's some very interesting specifics here because we actually found out the biochemical mechanisms involved in acupuncture's effective action. It has to do with endothelial cellular function and how acupuncture regulates that aspect of biochemistry. So it ultimately comes down to nitric oxide and how acupuncture interacts with those levels in the bloodstream. So take a look at healthcmi.com. It's definitely not the only article on the treatment of hypertension with acupuncture, also with herbal medicine. What we find here ultimately is that both drugs, herbal medicine, and acupuncture offer results for patients with high blood pressure with hypertension. We also find that a combination of acupuncture with drugs produces less adverse effects and optimal patient outcomes. There are advantages on all sides, but what we ultimately have to ask ourselves is what affects patients' access to care. Drugs, in many cases, are affordable, especially when they're covered by insurance. Sometimes they're cheap, they're portable, you can put them in your pocket, take them where you go. People who are, let's say, elderly or disabled, have transportation issues, may not be able to easily get to an acupuncture appointment. They may not be able to pay for it if it's not covered by insurance. Yet we know from the research that a combination of drugs and acupuncture produces optimal clinical results. So what are the mechanisms in place in our society that can get people to the care they need? Take a look at healthcmi.com, click on the news link, and look for the article, Acupuncture Matches Drug for High Blood Pressure, published February 16, 2017, and learn more. Thank you for listening.